There's a saying that health is wealth. The healthier you are, the less medical problems you'll have. But people often put more effort into maintaining their cars than they do their own bodies. That's why it's important to have a yearly physical. Joining me now to talk about Midstate Medical Center is Brumberger, Dr. Bruce Brumberger, and physician's assistant Jill Aboulian. Thank you so much for being here. Today we're talking about the importance of the yearly physical. A lot of people might skip over it if they're feeling well. Doctor, tell us why we shouldn't be doing that.
Well, we're trying to get people to think about staying healthy and being healthy. The old physical used to be, come in and I'll see if I can find a hidden disease. Now we're trying to prevent those diseases and make you a partner. And if we bring you in regularly and keep emphasizing, are you exercising? Did you lose weight this year? Has your cholesterol been checked? We feel that if you do it yearly, eventually you're going to decide to do some of those things. It may be the third visit before you actually start exercising 15 minutes, but the more you say something to somebody, the more likely they'll do it later on.
Sure, and getting that routine of checking numbers, that type of thing.
Yep.
And you also mentioned that you actually review safety issues. That's something kind of new.
Yes. Do you wear your seatbelt? Do you have a fire plan? People look at me when I ask them, do you have a fire exit plan? So I ask them, do you sleep on the second floor? Yes. How many stairways go up there? One. And if it's on fire, how do you get out of the house? And they go, I jump out the window. So I suggest, go to the store, buy a chain ladder, get a fire extinguisher. You have a plan. Sure,
that's great, Doctor. You get them thinking.
Some people, right, have never thought about it. They said, Doctor, I've never thought about it.
Jill, let me ask you why it's so important for you to know your numbers, your blood pressure, your weight, your cholesterol.
Well, it's really all about screening for illness. And if we can identify risk factors early, we can treat and manage those problems early on and a lot of times reverse conditions of prediabetes or mild hypertension effectively.
Sure. And say, for instance, you do find something. How do you counsel the patient or prepare them for treatment?
Well, I would say counseling is probably a bulk of what we do in primary care. Every visit, not just on the physical. But we're touching on all things as far as lifestyle, including maybe their smoking habits or eating habits or exercise habits. We also counsel people on
well, ways to maintain a healthy lifestyle, I'm sure, right?
Perhaps, yes, yeah.
All right, and Doctor, you mentioned this earlier in the interview here, developing a relationship with your primary care. Doctor, how important is that?
Well, I've had situations where I've actually had the great-grandparent all the way down to the great-grandchild in the room at the same time. Wow. If a patient looks at the doctor visit as a sort of a family issue, somewhere to go for comfort, they're liable to pay attention to what you want to say and carry out what you do. People that have a really good trust in their doctor turn to me for anything going on. The kids' school grades aren't well, dating issues. I mean, I get called for all that stuff.
You do?
Because, yes.
That's interesting stuff. I mean, how can people choose a primary care doctor, would you say?
When they ask me, I basically say, if you're in a situation where you don't know anybody, ask your friends. Who do they go to? Who do they like? Ask your people you work with. And with the internet, I mean, you can find out what I had for breakfast last Tuesday, so you can check on doctors.
It's all very public, right?
Yeah, you can check on doctor reviews, Amy's List, all that stuff.
Now, let me ask you another question. It's flu season. We're in the height of it right now. Jill, what have you been seeing this time of year?
Well, we've been seeing an abundance of flu. Unfortunately, the season is markedly worse this year than it was last year. We've been managing it through, our walk-in center and our primary care office.
Any advice for people who might be dealing with this or to prevent it?
Well, if you have symptoms of the flu, stay home, limit your contact with other people. Call your doctor or be seen early, because if we find it early, we can treat it with a shot or medicines to shorten the course of the illness.
And keep it from spreading, right?
Absolutely. And get your yearly flu shot, especially if you have certain risk factors.
Very good. All right, let's put some information up on the screen. Midstate Medical Center is located in Meriden. You can go to midstatemedical.org or call 203-694-8200. Dr. Jill, thanks so much for being here and sharing the information.
Pleasure.
Thank you.
All right, coming up next, Chef Barbara shares a recipe for a light and luscious dessert. But first, take a look at this.